Hi, my name is Rachel Cunningham and I'm a first year nursing student with the University of Windsor, and I'll be performing my OSCE midterm video right now. So first, to start off, before we get started, I am wearing my uniform or my badge where my patients can visibly see it, keeping my sleeves rolled below the wrist, no watches, no jewelry, only studs, and keeping my hair off the back of my neck, and keeping my nails short and trimmed. And so first, I will be showing you how to properly use hand hygiene. So you'll be putting on 3 to 4 milliliters of hand sanitizer into your hands, rubbing vigorously for roughly 15 seconds, getting on the backs of my hands and in between my fingers, getting up on my wrists, on my thumbs, and underneath my fingernails until it is completely dry. And so when I'm going into my patient's room, I look at the door and at the chart, and I can see that it is a COVID-19 patient in isolation, and for that I'm going to be needing to do contact and droplet precautions. So first, to start off, I will be putting on my gown because I've already done my hand sanitizing. And for my gown, I have to tie up around the back of my neck, and around my waist. And next I will be putting on my mask. Now my mask already has the eyewear protection on it, and if I wasn't to have this, then I'd put my eyewear protection on it after. And then I will be pinching my nose to make sure that there's no gaps and pulling it low under my chin. Next, I'll be putting on my gloves and making sure that it is around the cuff of my gown to prevent any skin contact. Now I'm ready to go into my patient's room, remembering to use therapeutic communication. Once I walk in, I'll be closing the door behind me to help keep privacy for the patient. Hello, my name is Rachel Cunningham, and I'm a first-year nursing student with the University of Windsor. What's your first and last name, and what is your birthday?
Lauren Falaka. My birthday is April 13th, 2001.
Okay, and I either check on my chart or I can check on the patient's wrist to confirm that. Thank you. So for the reasons for your isolation is because to help prevent any infections from leaving this room or from hurting me. And the reason I'm wearing all this PPE is to help protect myself and you as well. Can I get you anything today?
No, I'm good. Thank you.
Okay, if you need me at all, there's the call button right beside you.
Perfect.
And then I'll be exiting the room. Remembering to close the door behind me. And now I will be showing you how to properly doff your PPE. So first off, you're going to take your gloves off. So you grab the inside of your palm and pull it off, scrunching up into a ball and sticking my finger underneath the glove and disposing of that properly. Next, I will be removing my gown. So I will be untying the back of my gown and untying around the back of my neck and taking it off, trying to make sure I do not come into contact with the outside of the gown. And I'll be folding it outwards and rolling it away from my body. And disposing of that properly. Now before I touch anything to do with my face, I'll be washing my hands. Again, using hand hygiene. So again, putting on more hand sanitizer, 3 to 4 milliliters, rubbing vigorously. Using the backs of my hands and in between my fingers, around my wrists, my thumbs, and under my fingernails until my hands are completely dry. Now I'm okay to take off my mask and my eyewear protection before my mask. So I'm going to take that, keeping it away from me, and disposing of that properly. Now before I'm ready to go, I have to do one more hand sanitizing. So again, 3 to 4 milliliters on my hands, rubbing vigorously on the backs of my hands for roughly 15 seconds around my wrists, my thumbs, under my fingernails until it is completely dry. Thank you for watching.